The second chapter will be discussed in MSK1. The term that used for description of lesion on the plane X-ray, the first one is the when there is a focal reduction of bone density. What is the term used for description of focal reduction in bone density?
Lytic lesion. Lytic area.
And if there is generalized decreased bone density?
Osteopenia.
Osteopenia. So osteopenia is the term used for description of generalized decreased bone density. For localized or focal reduction in bone density, we use lytic lesion. Periosteal reaction. There are many types of periosteal reaction. The first one is the smooth lamellar periosteal reaction. What is the cause of this smooth? This one, smooth lamellar periosteal reaction.
Inflammation, trauma.
Non-accidental trauma. Trauma is the cause of smooth lamellar reaction, and speculated reaction or sun ray.
Benign. Carcinoma.
Osteogenic sarcoma.
Yes, osteogenic sarcoma or osteosarcoma. And what is the name of this periosteal reaction? ده بنسميه
Onion skin.
onion skin. Onion skin. Onion skin is feature of what? Feature of what? The cause of this
Ewing
onion
sarcoma.
skin. Ewing sarcoma. طيب Ewing sarcoma common in which age?
Young.
Young, yes, in the young patient. And what is the feature of Ewing sarcoma on plain X-ray? In which bone it is more common? In the which side? If usually seen in the long bone, مثلا. Long bone, and it affects the diaphysis. More commonly seen in the diaphysis, and characterized by multiple lytic lesion. Multiple lytic lesion. Even in the diaphysis, يكونوا young about مثلا 13, 14, 15, 16 years. with ضروري تعرفوا الفيتشر دي انه هي الايج بالاضافه لانها in the long bone in the diaphysis you can see the multiple lytic lesion with onion skin periosteal reaction. إذا عندنا just in the X-ray for the patient of the مثلا lower limbs illustrate this multiple lytic lesion in the diaphysis, the epithelial multiple lytic lesion with onion skin reaction in this مثلا 15 years old, but this is most likely to be with onion skin reaction, but this is a Ewing sarcoma. Ewing sarcoma. إذا عرفنا sun pairs or speculated sun ray and onion skin and lamellar periosteal reaction. In addition to the sun pairs or sun ray or speculated, عندنا الكودمان triangle also is the feature of osteogenic sarcoma. That's the elevation of the periosteum. What also is a feature of osteogenic sarcoma. Osteogenic sarcoma. طيب نحب اتكلمنا كده مثلا ممكن نستخدم الالترا ساوند for taking for guidance needed for aspiration of the مثلا hepatic abscess. If there is a deep lesion in the bone, مثلا deep lesion, bony lesion, and we want to take a biopsy, what imaging techniques that help us in guidance of needed to take biopsy?
CT.
Yeah, نعمل CT. Yes, CT. طيب الالترا sound can be used for assessment of the congenital hip dysplasia according to the age. And usually for the patient less than 6 months, we can use ultrasound. And in patient less more than 6 months, we can use X-ray. Why? Use ultrasound for patient less than 6 months. ليش استخدمنا هنا ultrasound وهنا CT تتوقع؟
opacification
Yes. يعني ما بيحصل ما في ossification يعني الكارتلج يعني البون بيكون ستيل كارتليجينيوس in less than 6 months. لذلك إذا عملنا X-ray ما بتكون مبينة معانا. فلذلك we use ultrasound for assessment of this hip or this joint by ultrasound. لكن after 6 months بيحصل ossification. طبعا في الحالة دي X-ray can demonstrate this joint well, so we can use. لذلك إذا قلنا patient عنده suspected hip dysplasia ودايرين نشوف which imaging modality is appropriate, you have to look to the age. If less than 6 months, the preferred and the appropriate imaging technique is ultrasound. More than 6 months is X-ray. Also, ultrasound can be used for assessment of joint fusion. لكن MRI is better than ultrasound. لكن ultrasound can يعني one of the good imaging techniques for assessment of the joint fusion, and also it can be used for aspiration of this fluid and the guidance of ultrasound. طيب in the nuclear medicine is a patient into fracture يعني subtle fracture. This radioglide bone scan can demonstrate this fracture. When this bone fracture can be demonstrated by radioglide bone scan.
early.
Yes. يعني in the first hour يعني.
First
2 to 3 days.
Yes, 2 to 3 days. يعني أحيانا بيكون عندنا fracture subtle fracture. يعني إذا عملنا X-ray ما بيكون مبين معانا. subtle يعني بيكون شعرة زي ما بقول. the radioglide bone scan can demonstrate this fracture within 2 to 3 days. Within 2 to 3. طيب MRI, the value of MRI in assessment of the bone. أول شيء MRI is good for assessment of bone marrow. For assessment of bone marrow. يعني bone marrow not a cortical bone. For the bone marrow MRI is the يعني حتى هي sensitive for detection مثلا إذا كان عندنا osteomyelitis or metastasis. This MRI can demonstrate this bone marrow abnormality earlier compared to CT and X-ray and other modalities. Also MRI can be used for assessment of soft tissue. عندنا soft tissue structure مثلا tendons, ligament. MRI is superior in assessment of this part. And also MRI زي ما قلنا هي good يعني the superior method for assessment of joint fusion. Ultrasound can be used لكن MRI still is the superior. And for the sport injury كل الأشياء دي ultrasound MRI is the best. طيب إذا كان patient suspected scaphoid fracture يعني patient مثلا عملنا clinic examination عندنا tenderness وكان fall present with pain, hand pain after falling, and there is a maximum tenderness at the scaphoid bone. What initial imaging technique should be done for assessment of this patient?
MRI.
The initial one.
X-ray.
X-ray. Yes. The initial investigation نعمل X-ray. لكن زي ما انت قلت here MRI is the best. لكن you have to start with X-ray. So the initial or the first imaging technique should be done for this patient is X-ray. لكن MRI is the best. يعني X-ray ممكن تكون normal يعني ما مبينة لنا الفراكشر دي. لكن you have to do it first. طيب stress fracture What is the clinical presentation of stress fracture?
Military, or like repetitive.
Yes, it is more common in the يعني soldiers يعني that work in the military. Yes, and also in the marathons يعني الناس اللي في الماراثون they are برضه more common in this case. But what is the clinical presentation? أنت قلت more common
Pain.
in which pain? Yes, this pain is يعني on rest or
The activity.
yeah, this activity يعني relief by rest. يعني هو this pain increase with activity and relief by rest. زي ما هو قال common in the soldiers or marathoners or more common indeed. Or more common indeed. Tarsal bone and tibia. And what how to assess this stress fracture by imaging. نعمل ايش؟ First
X-ray.
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 Although this X-ray may be normal, but you have to do it first. يعني هي usually تكون normal. And what is the most sensitive imaging technique for stress fracture?
MRI.
MRI or
CT.
MRI and what? And the two techniques, MRI or
Radionuclide.
yes,
X-ray.
radionuclide and MRI. Both are more sensitive than plain X-ray. فهي plain X-ray ممكن تكون normal, especially in before يعني 2 weeks كده. لكن after 2 weeks بيكون عندنا يعني بتكون مبينة. تتوقع ليش؟
And sclerosis.
yes أنا بيحصل sclerosis يعني بيحصل healing. فلذلك هي this is بتكون لك مبينة later. لكن in the early يعني that الفراكشر ما بيكون مبين. Later it may be seen on the plain X-ray. لذلك إنه the MRI and the radionuclide bone scan are more sensitive than plain X-ray in detection of this stress fracture. طيب how this fracture appear on MRI?
Fracture lines.
Fracture line. When the fracture line زي دي is fracture line, hypointense fracture line. And how this stress fracture appear on radionuclide bone scan?
Increased uptake area.
Yes, area of increased uptake. Area of increased uptake. طيب Colles fracture. Compare between the Colles fracture and اللي بيشبه الكولس fracture اسمه ايش؟ الفراكشر اللي بيشبه
Smith.
سميث fracture. طيب compare between Colles fracture and Smith fracture.
Both in the distal radial.
Yes.
Colles fracture is anteriorly anterior angulation.
Anterior angulation, are you sure?
No, dorsal angulation dinner fold.
يعني posterior. dorsal or posterior. كده dorsal or posterior angulation. And this is the Smith fracture اللي هو بيسموه reverse Colles fracture. This is Smith fracture. فلذلك هو زي ما قال both this fracture occurs in the شنو distal radius اللي هو lower radius. بس الفرق الوحيد الangulation. يعني دايما بنشوف in the lateral. Is it anterior or posterior? يعني is it dorsally or ventrally?
Anterior.
Anterior in this no Smith fracture
And
and posterior in the Colles fracture. This is a difference. The patient usually present with what is يعني common presentation before history of what?
fall on hand
outstretched hand. يعني يجب أغلب البيشنت بيجوا بي falling on outstretched hand. بعد بنيجي نعمل لهم اكس راي، يعني you can see the fracture in the AP، نلقى الفراكشر in the distal radius. لابد تعمل lateral to look for the angulation. Is it posterior or anterior to discriminate between the Colles fracture and Smith fracture. طيب سالتر هاريس، طيب أكيد very easy for you. طيب anyone can explain the different classification of Salter Harris, how to classify the fracture with Salter Harris?
Okay, type 1 will be transverse fracture through the entire physis.
Yes. Like
And
this.
type
يعني
2 will involve physis and metaphysis.
Yes.
Type 3, there is a fracture in epiphysis and physis also, but in you can see involving both as the type 1, it's just like the type 1.
In type 5.
Sorry?
Type 5, what is the feature of type 5? Salter Harris type 5.
There is crushing of physis.
طيب on X-ray نحن بنتكلم عن X-ray. What do you see on X-ray?
Translucent line.
Yes, you see the physis
decreased
or
space.
decrease, yes, the physis or epiphyseal plate reducing distance. يعني بتكون شنو؟ get smaller. يعني this is the number 2 physis get smaller. يعني reduction in the physis space or epiphyseal plate in the type 5. فلذلك احنا ممكن نجيب لك انه عملنا multiple X-ray of the patient and demonstrate. ممكن نقول لك انه fracture in the epiphysis or metaphysis or both. What is the classification of this fracture according to Salter Harris. فانت لابد تكون عارف how to classify the fracture according to this classification according to involvement of the bone. يعني إذا كانت in the physis only في separation like this, so this is type 1. type 5 بيكون عندنا reduction in the physis، ده type 1 ده type 5. in between عندنا الفراكشر بتكون involving the metaphysis or epiphysis or both. إذا كان in the metaphysis like this, so this is type 2. if it is epiphysis, type 3. if it's involving all metaphysis and epiphysis, so this is a type 4. اتوقع انه ايزي. نحن بنجيب لك description انت according to description تعرف لي انا which type is this. طيب what sign do you see in this X-ray?
light bulb.
Light bulb. What is the diagnosis or this sign associated with which abnormality?
Posterior dislocation.
Posterior dislocation. What is the يعني the clinical presentation of patient with posterior dislocation?
Severe pain.
Pain. This pain following what يعني يكون عندنا history of what?
Falling on the ground.
falling.
Or
البيشنت غالبا يكون عنده يعني بيليبسي او after شنو electric shock. اغلبهم بيجي بشنو electric shock or fit seizure. ممكن يكون عنده tonic colonic مثلا convulsion ويحصل له this dislocation posterior dislocation of the shoulder. إذا البيشنت عنده history of the مثلا falling after electric shock or after epileptic seizure و X-ray demonstrates this sign اللي هي light bulb فthis is the posterior dislocation. أو ممكن أقول لك إنه the patient diagnosed with posterior dislocation what is the sign? Sign is a light bulb. تكون عارف light bulb is a sign of posterior dislocation. Posterior dislocation of the shoulder. طيب what is this? The black area دي ايش دي؟
posterior horn of medial meniscus.
posterior horn of medial
meniscus.
meniscus. طيب if there is a partial tear, how this partial tear appear on the MRI knee? بس هنا في
high
partial
signal hyper intensity.
yes عندنا hyper intensity زي الخط الأبيض الموجود هنا في الوسط دي هنا دي نورمال ما في تير لكن هنا في تير فإذا شنو characterized by the hyper intensity this is a tear أو ممكن تكون due to degeneration أيضا due to degeneration or tear partial tear or degeneration. نفس الكلام ممكن يتكلموا عن شنو ال ACL. ACL إذا كان عندنا partial tear إذا عندنا complete tear يكون بيحصل disorganization of the شنو of the ligament. لكن إذا كان عندنا partial tear also seen as شنو signal within the ligament. يعني بيظهر لنا برضه زي السيجنال اللي شفناه في المينيسكاي دي can be seen if there is a partial tear in the ACL يكون عندنا نقطة بيضاء كده مثلا أو خط أبيض in the partial tear. لكن إذا كان عندنا complete disruption ممكن يحصل disorganization بيكون ممكن الليجمنت ما يكون مبين معانا not visible يحصل disruption and disorganization. لكن إذا كان في partial tear seen as the high signal within the ligament. عندنا partial tear. إذا تعرف how the partial tears appear partial tear of the crochet ligament appear on MRI knee as شنو high signal within the ligament. Have any question?
Can you repeat the last point, doctor? Regarding the cruciate ligament and
this is مثلا PCL this is ACL normal بيكون hypo intense normally hypo intense linear structure with normally hypo intense. إذا كان عندنا partial tear هيكون عندنا شنو signal يعني يكون عندك signal intensity on the area of the affected ligament. يعني مثلا ده ال ACL إذا كان عندنا partial tear بيكون عندنا خط أبيض دي شنو بيسموها شنو signal on the شنو on the affected ligament. إذا كان عندنا شنو partial tear. لكن إذا كان عندنا complete يعني disruption ممكن تلقى المنطقة كلها ما مبينة. لكن in the partial tear بس بتلقى signal on the high signal يعني منطقة بيضاء.
يعني hyper intensity.
Yes, hyper intensity.
Okay.
نفس الكلام اللي قلناه برضه في زي اللي هي المينيسكس. المينيسكس برضه إذا كان عندنا partial tear أيضا بنلقى signal hyper intensity يعني high signal or hyper intensity يعني يعني شنو هاي تكون بيضاء يعني hyper intense or of high signal الاثنين معناتها حاجة بيضاء.
The what is the hyper intensity, doctor? Is it the fluid or
within the ligament. ما الليجمنت هو totally black. هسه هو ده كله اسود. لكن اذا كان عندنا partial tear هتلقى خط هنا في المنطقة السوداء دي تلقى خط زي شفناه في يعني this is normal هايبو انتنس اللي هو المينيسكس is normally هايبو انتنس like this. لكن عندنا بارسل تير within the hypo intensity بنلقى خط ابيض كده يعني موجود داخل المنطقه السوداء دي، فده عارفين انه there is a partial tear. You got me?
Yes, but is the partial the hyper intensity, is it the ligament or what is it?
يعني
Why does
ما
it
عندنا
appear?
tear in the meniscus مثلا او tear in the ACL tear in the partial tear. فاذا حيكون ما حتكون نورمال طبعا السيجنال انتنسيتي اوف ذيس ليجامنت نوت يعني ما حتكون نورمال، هيظهر لنا خط ابيض او منطقه بيضاء ذيس ليجامنت. يعني نورمال المفروض تكون homogeneous hypo intense linear structure like this is a normal ACL. طيب اذا البيشنت حصل له ما partial tear هل حتكون طبيعيه كده؟ نو. هنشوف في سيجنال اللي هو سيجنال يعني شنو؟ hyper intense or of high signal intensity within this ligament. يعني لقينا منطقه بيضاء في المنطقه شنو في in this ligament. يعني ما حيكون دارك totally dark، حيكون في high signal.
Yes, doctor. Thank you. I get it now.
Do you have any query or the last chapter? Osteoporosis. Osteoporosis is the reduction in bone density and the risk factor. Yeah, postmenopausal, elderly, and low vitamin D, smoking, alcohol consumption, and what drug should be asked about when there is a history of when there is osteoporosis.
Omeprazole.
Yes. Omeprazole. Omeprazole اللي هو used for the parasite دي اللي هي what do you
Vitamin D or calcium.
yes vitamin D, calcium, and what drug other drug يعني هي صح vitamin D is a drug and calcium is a drug.
Maybe estrogen.
Yes is steroid يعني هو برضه common in the patient بياخدوا steroid برضه one of the cause of the reduction of bone density steroid. طيب what is the feature of osteoporosis in plain X-ray؟ بنلقى reduction of bone density. البون بدل يكون الدنسيتي بتاعته نورمال بيحصل reduction of bone density in addition to loss of normal bone trabeculation. Normal trabeculation lost. What is the best imaging technique for assessment of osteoporosis?
Lateral X-ray.
The best
DEXA scan.
DEXA scan. لكن زي ما قلت إذا ما عندنا DEXA scan the next option is the lateral X-ray of the spine. Lateral X-ray of the spine. لكن the best is DEXA. إذا ما عندنا DEXA ما بنعمل شنو lateral X-ray of the spine. طيب osteomalacia patient clinical presentation patient present with bone pain and tenderness. The features loss of bone density and thinning of the trabecular cortex and lower zone and bone deformity. أهم شيء عندنا السلايد دي عندنا two signs مهمة. The first one is called what؟ دي قلنا اسمها ايش؟
Codfish vertebrae.
Yes, codfish vertebra اللي هي contiguous بيحصل concavity أو contiguous emblate. This is the codfish vertebra. The codfish and the other sign the long bone ايش هي؟
Loser zones.
Loser zone or pseudo fractures. Loser zone or pseudo fracture. إذا ممكن أقول لك loser zone is the feature of 1 2 3 4 فإذا أنت تعرف of osteomalacia. أو codfish vertebra is the feature of what؟ osteomalacia. أو العكس نقول لك إنه osteomalacia characterized by which of these signs؟ إذا تعرف lucid zone and codfish vertebrae. What are the signs of rickets on plain X-ray?
Wide growth plate.
Yes, wide and
Cupped metaphysis.
cup of the metaphysis with irregularity of the fraying and irregularity of the metaphysis with widening of the cross plate. This is a sign of cupping and fraying of metaphysis and regular widened cross plate. And on the chest X-ray, idea, sign there.
Increased
Rachitic rosary.
rachitic rosary. فإذا ممكن أقول لك إنه on the chest X-ray the sign of the ricket is rachitic. What rachitic rosary, rachitic other false يعني إذا نعرف rachitic rosary is a sign of rickets on the chest X-ray. ونعرف الفيتشر دي مهمة جدا features of the radiological feature on manifestation of rickets on the plain X-ray. طيب hyperparathyroidism on the hand. What is the pathognomonic feature of hyperparathyroidism on the hand X-ray?
Subperiosteal bone.
Yes, supraosseous bone resorption. Supraosseous bone resorption. What is the characteristic side of this supraosseous bone resorption or position? يعني usually seen in which bone?
Distal phalange
Distal phalanges.
or
Sure.
Middle
Terminal
phalanx.
Medial.
I'm
Yes.
guessing
Terminal
middle
phalanx.
middle
Mid-
phalanges.
Yes.
Tip of the
middle
terminal.
Yes. Of which finger?
third.
Second and third.
Second and third finger, medial phalanx towards which side or aspect?
Radial.
Radial.
Radial aspect. إذا نعرف you have to look to the second and third finger in the medial phalanx towards the radial aspect. فلازم تكونوا عارفين the characteristic position of this supraosseous bone resorption happen in the medial phalanges, radial aspect in the second or third finger. نحن نشوف الفينجر دي two second and third radial aspect in the medial phalanges. فدي the most obvious sign تكون most obvious in this finger اللي هي second and third radial aspect in the middle phalanges. فthis is the characteristic feature. أول تعرفوا إن هي اسمها supraosseous bone resorption and characteristic. طيب what is this sign؟ الساين دي بنسميها ايش؟
Roger Jersey spine.
Jersey spine. Jersey spine اللي هي بيحصل alteration between the density, lucency, density, lucency, density and lucency. يعني دي لاحظوا إنها هنا dense in the center تكون lucent, dense, lucent, dense. يعني alteration between the شنو sclerotic, lucent, sclerotic, lucent appearance. فبتشبه لنا زي اليونيفورم دي فسموها Jersey spine. This Jersey spine is commonly seen in the secondary hyperparathyroidism in patients with renal dystrophy. إذا Jersey spine is the renal osteodystrophy. يعني البيشنت بيكون عندهم غالي مثلا chronic renal failure أو كذا renal osteodystrophy فبيحصل لنا شنو زي Jersey spine. إذا ما عليك إلا تعرف إنه Jersey spine is associated with which abnormalities? Associated with renal dystrophy. Renal dystrophy is associated with Jersey spine. طيب what are the signs of acromegaly on skull X-ray?
Thickened calvary,
Yes, kind of the calvaire bone.
increased size of frontal sinus,
Increase size of frontal sinus
widened ciliary
and the cell tertius, ballooning or enlarge or prominent of the cell tertica,
and occipital protuberance.
occipital pteris is prominent also.
And the jaw is enlarged.
The jaw will get more enlarged. So this is a sign of acromegaly. طيب what is this sign?
Also thickened calvarium,
Yes, thickening, and what else?
Hair on
Hair.
end.
Hair on end appearance. طيب what are the causes of hair on end?
thalassemia,
And what
Mm.
else?
sickle cell.
Sickle cell. يعني usually seen in the chronic hemolytic anemia such as sickle cell anemia and thalassemia. So sickle cell anemia and thalassemia characterized by this, sign, hair on end. طيب what mentioned يعني two causes كلنا two causes that causing increased bone density.
budget disease,
Budget disease and what else? In a condition characterized by generalized increased bone density.
Acromegaly.
Yes, what? Generalized increased bone density. Pardon? اسمع.
Acromegaly, maybe.
Acromegaly. Acromegaly, يعني like this, causing generalized increased bone density.
No,
Is it
osteopetrosis.
Yes, osteopetrosis. Osteopetrosis. عندنا the budget disease and osteopetrosis. في others لكن عندنا budget disease. طيب in addition to increased bone density, what other manifestation of budget disease on plain X-ray? يكون في increased
Thickening
bone
of the
density.
tubercle.
Yes, بيكون في enlargement of the affected bone and thickening of the trabeculation. But this is increased bone density. Increased bone here compare between the two sides. Increased bone density with the enlarge of affected bone compared to between the two sides, the size of this bone. Keep bone in both in a more enlarged and with increased bone density and thickened trabeculation, coarse and thickened trabeculation. So this is the budget disease. And also thickened trabeculation, increased bone density and enlarged bone, budget disease. And in osteopetrosis or marble bone disease, also there is a generalized increased bone density. لاحظوا كله بقى more fried, more dense. But this is a congenital disorder and the patient بيكون liable to fracture. بيحصل له easily fracture. البون بيكون easily to be pretty. Rheumatoid arthritis. What is the initial imaging technique for assessment of rheumatoid arthritis?
X-ray,
نعمل X-ray. طيب what are the rheumatoid arthritis features on plain X-ray? طبعا ممكن تكون early or late. ممكن نعمل X-ray early or late.
early osteopenia,
Osteopenia. Yes.
one
late
neck
joint space narrowing,
Yes. On non joint space narrowing and erosion. فدي طيب one of the الحاجة المهمة برضه تعرفها إنه rheumatoid arthritis can cause atlantoaxial subluxation اللي هي بتزيد الديستنس between the arch of the atlas and the deltoid ridge. Deltoid ridge and arch of the atlas. لما اسمه atlantoaxial subluxation. One of the cause يعني ممكن اقول لك which of the following causing atlantoaxial subluxation. تعرف انه rheumatoid arthritis. أو which of these conditions can يعني causing increased distance between the arch of the atlas and the deltoid ridge اللي هي ايش؟ دي rheumatoid arthritis. إذا rheumatoid arthritis زي ما انتوا قلتوا انه تعمل لنا شنو particular osteopenia, decrease the bone density with the narrowing of the joint space. بيحصل لنا شنو بعد ذاك ممكن erosion. طيب ankylosing spondylitis clinical presentation patient بيجي بايه؟
stiff joint.
stiff joint. Which joint?
Right. Sacroiliac.
sacroiliac. طيب هو ممكن يجي ببلفيك بين. يس ممكن يجي ببلفيك بين. طب هو طبعا اول شيء affecting the sacroiliac joint زي ما انت قلت هو starting from the sacroiliac joint بعد ذاك بيحصل involvement of the spine لكن هو starting the sacroiliac joint لذلك ممكن يجي ببلفيك بين وممكن يكون يعني زي ما قلت stiff of the hip joint then إذا حصل involvement of the spine البيشنت بيكون عنده symptoms like what؟ لأنه هو عنده manifestation على السacroiliac joint وعلى السباين. هو starting with the sacroiliac joint ممكن البيشنت يجي ببين و pelvic pain يعني. لكن إذا كان حصل involvement in the spine البيشنت بيجي بشنو؟ stiff back يعني difficult in شنو؟ يعني يكون عنده stiff back زي كان حصل involvement of the شنو؟ of the spine. طيب what are the features of ankylosing spondylitis on plain X-ray regarding the sacroiliac joint?
Ankylosis.
Because of sclerosis, haziness and fuzzy and يعني sclerosis around the sacroiliac joint. بعد ذاك بيحصل لها ممكن يحصل لها fusion تكون irregular fuzzy sclerosis around the sacroiliac joint. بعد ذاك ممكن يحصل لها شنو؟ يعني fusion. This is a sign يعني إذا كانت affecting the شنو sacroiliac joint. يبقى starting زي ما قلنا manifestation of ankylosing spondylitis starting in this point. Then بعد ذاك بيحصل involvement of the spine. What are the sign or radiological manifestation of ankylosing spondylitis on X-ray of the spine?
Dagger sign.
إيش؟
Dagger sign. بس
Dagger sign and what else?
bamboo.
bamboo spine. طيب الهيد Dagger sign بتكون كيف والبامبو spine بتكون كيف؟
Dagger sign is a dense line.
اللي هو الدنس لاين اللي هي ايش؟ اللاين ده اللي هو بيكون ايش؟
Spinous ligament.
The spinous ligament. And bamboo spine
Just the fusion or
that's
In
the
the
fusion of the
intervertebral.
spine. That's the connection and fusion of the spine. بتبقى كأنها one unit fusion of the spine يعني حتى الانترفيرتبرال ديسك سبيس ما موجودة لأنه بيحصل fusion فبتشبه لنا شنو؟ البامبو. فإذا bamboo spine or their sign the sign of the ankylosing spondylitis. طيب osteoarthritis in which group this osteoarthritis is more common? osteoarthritis.
older
Menopause.
adults.
يعني elderly يعني common in elderly. Yes.
Obese.
Or obese, an obese patient. Yes.
Postmenopause.
Postmenopause. Yes. Like what are the features, radiological manifestation of osteoarthritis on plain X-ray?
Osteophytes.
Osteophytes.
Multiple osteophytes.
Multiple what?
Yeah, osteophytes.
Osteophyte, yes.
Subchondral sclerosis.
Subchondral sclerosis, yes.
Vacuum disc phenomena.
Vacuum disc phenomena this seen in the lumbar spine يعني ما بنشوفها in the مثلا knee or other. Vacuum disc phenomena لازم نشوف في air in the disc space. So this is a sign of osteoarthritis in the in the spine. What is the X-ray زي ما قلت في sclerosis, subchondral sclerosis اللي حصل هي المنطقة دي بيضاء subchondral sclerosis with osteophyte. وأهم حاجة إيش؟ الجوينت سبيس مالها
Decreased compartment space.
narrowing.
narrow or decreased joint space. Subchondral sclerosis with osteophyte وأحيانا بيحصل لنا subchondral cysts يعني ما احنا الطين دي لازم تعرفوها كويس. irregular joint space narrowing دي space narrowing. subchondral sclerosis المنطقة بتكون بيضاء subchondral sclerosis with osteophytes liver bone spurs and subchondral cysts. So this is a feature of osteoarthritis. مهمة جدا this feature. الفاكيوم phenomena. Gout أول شيء characterized by increased blood uric acid. وأهم شيء فيه تعرفوا إنه هو بيكون فوقه soft tissue أكثر من باقي الأرثرايتيك ديزيز يعني الروماتويد والكذا. فهي فوقه soft tissue أكثر من soft tissue swelling. وبيحصل فوقه erosion. حتى هو الروماتويد بيحصل فوقه لكن ده more يعني الايروجن بيكون more compared to the rheumatoid arthritis. والفرق بين الروماتويد arthritis بون الروجن والجاوت انه في سكلوريتيك مارجن. لاحظ انه هنا مثلا في الروجن، لاحظ انه السكلوروزيس الخط المنطقه دي بيضاء دائما المارجن بتكون فيها سكلوريتيك مارجن. سكلوريتيك مارجن في منطقه بيضاء في المنطقه بتاعت الروجن سكلوريتيك مارجن. الايجي بتكون سكلوريتيك بيضاء بالاضافه للسوفت تيشو هي مارك سوفت تيشو اكثر من الاذرز ارثرايد. طيب الفاسكولار نيكروزيس مهم جدا. اذا كانت ايديوباتيك بيسموه بيرث ديزيز. دونت ميس ذيس بيرث ديزيز دي مهمه جدا. بيرث ديزيز اللي هو ايديوباتيك vascular necrosis. This is idiopathic vascular necrosis common in the patient بيكون الايج بتاعهم 4 to 8 years. يلا how this first disease اللي هي vascular necrosis idiopathic vascular necrosis appear on X-ray. إذا عملنا X-ray خاصة إذا عملنا multiple X-ray serial X-ray التشينجز بتتغير من وقت لآخر لحد ما يحصل لنا شنو؟ collapse of the articular surface. يعني إذا عملت serial X-ray in the earlier you can see minor osteopenia. يعني لذلك نحن كنا نقول لك إنه عملنا serial X-ray demonstrate minor osteopenia. بعد ذلك حصل في الأذر مثلا النكست حصل شنو؟ sclerosis. بعد ذلك حصل micro fracture then end by collapse of the articular surface. So this is the feature of Birch disease. أما شيء تعرف إنه هو ما حتشوف كل الساين دي، يعني دي اللي تكون عملت فولو اب. البداية ممكن تكون بس minor osteopenia. then ممكن يحصل calcification بعد ذلك micro fracture لحد ما يحصل لنا collapse of articular surface like this. Collapse of articular surface. So this is the Birch disease. طيب osteodyostoma clinical presentation of osteodyostoma.
night pain.
Night pain that يعني typically relieved by aspirin. Night pain typically relieved by aspirin. فإذا جبنا بس الفيتشر دي ما حتى ما لأنه ده هو كاركترستيك اللي بتعرف إنه this is osteodyostoma. هي more common in the long bone especially the female and tibia. طيب بعد ذاك عندنا حاجة اسمها النايدس. النايدس دي اللي هي calcification within the lucency. يعني بيكون عندنا منطقة لوسن، منطقة سوداء. within this lucent بيحصل لنا calcification in the center of this lucency يسموها النايدس. زي أوضح هنا تقريبا. فديس calcification within the شنو؟ within the lucent or هنا ممكن نقول hypodensity. فديس is called nidus. إذا عندنا lucency in the center of this lucency there is a calcification, specks of calcification, and this is called nidus. إذا this is the characteristic features of osteodyostoma in long bone غالبا with lucency and central calcification اللي هي النايدس. الانيوريزمال بون سيست and giant cell tumor ديل الاثنين بيشبهوا بعض. giant cell tumor and aneurysmal bone cyst يعني ديل الاثنين الفيتشر بتاعتهم قريبة لبعض. طيب how to differentiate between them؟ aneurysmal bone cyst and giant cell tumor.
Fluid level.
Yes, which one is characterized by fluid level؟
The first one.
اللي هي ايش؟ first one.
Osteoid. لا مو.
Aneurysmal bone cyst.
Aneurysmal bone cyst. Yes, aneurysmal bone cyst can demonstrate fluid level. طيب what else? What other difference?
Adult versus child.
Yes.
Giant cell in adult.
Yes. فلذلك هم الاثنين ليتيك ليجن اكسبانسايل ليتيك ليجن. يعني نلاحظ في شنو انيوريزمال بون سيست ليتيك زي ما اتفقنا ان الليتيك هي اللي هي فوكال ريدكشن ان بون دنسيتي. دي اكسبانسايل ليتيك ليجن منطقه سوداء اكسبانسايل يعني كان حصل لها شنو اكسبانشن اكسبانسايل ليتيك ليجن. وكذلك شنو this is a lytic lesion expansile lytic lesion in metaphysis. Both are in metaphyseal part. In the metaphyseal part, the difference is presence or absence of physis. يعني is it closed or not. فلاحظ هنا this is occurs in young patient يعني children before closure of the epiphyseal plate. This is the aneurysmal bone cyst. لكن دي بنلقاها انه قاربا بعد شنو after closure there is no physis, there is no يعني الepiphyseal plate is closed fused. لكن هي الفيتشر تشبه بعض. both are expansile lytic lesion ممكن تكون eccentric location particularly in the metaphysis, but in giant cell tumor this lesion is seen after closure of the epiphyseal plate or broth plate, and in aneurysmal bone cyst occurs before closure of the epiphyseal plate. زي ما قال برضه بالاضافه لانه عندنا اذا عملنا MRI especially can see the شنو fluid level in aneurysmal bone cyst. طيب bone tumor, what is the best imaging technique for diagnosis of bone tumor?
In X-ray.
Plain X-ray. طيب plain X-ray is the best for diagnosis of plain. طيب what is the role of MRI and CT?
Spread or metastasis.
Yes, to assess يعني الأذر structure والميتاستاسيس الانفيجن وكده spreading يعني can have. What is the role of the radionuclide?
staging of the cancer.
Yes, staging اللي هي يعني تحدد لنا شنو الميتاستاسيس. اما السي تي والام ار اي اللوكال اكستنشن اوف ذا تيومر، يعني surrounding structure، يعني this bone involving مثلا الجوينت extension اللي على الجوينت، مثلا مصل adjacent مصل. لكن for the distant metastasis we the radioclide bone scan is more helpful. إذا أهم شيء تعرف إنه plain X-ray general plain radiography is the best imaging technique for making diagnosis. طيب osteosarcoma, what is the commonest age of osteosarcoma?
Five to 20.
5 to 20, yes. هي عندها bimodal distribution. This is the first age. وعندها برضه age in elderly. إذا كان patient عنده budget disease ممكن يحصل لهم برضه complication of the osteosarcoma. فيسموها عندها bimodal distribution. The first in the young, like from 5 to 20 years, and the other in يعني elderly عندهم budget disease بيحصل لهم شنو؟ osteosarcoma. What is the most common site of osteosarcoma? Site.
knee metaphysis.
That is of which bone يعني
knee,
yes. Common around the knee. Yes, around the knee. يعني in the يعني tibia يعني tibia especially tibia and femur يعني around the knee in the metaphysis. What is the radiological manifestation of osteosarcoma on plain X-ray?
Andre.
Sun ray. Yes, this is a prostate reaction. لكن هي يكون حصل لنا bone destruction sclerosis وبعد ذلك بيحصل لنا زي ما قلت sun ray or uncodman triangle. This is a feature of osteosarcoma. طيب how lipoma appear on plain X-ray?
Gray.
Great. يعني زي المصل كده.
لا darker than soft tissue.
لأن هي في content of the lipoma is fat. لذلك هي little darker than the muscle, little dark. How does the lipoma appear on CT?
Hyperdense.
Hyperdense.
هي dark اللي هي يعني بنقول عليها الترم what term used for description of darker area on CT?
Dense.
Hyperindense.
Hypodense.
Hypodense. ليش هي قلنا what other structure appear dark or hypodense in addition
Air.
to air and fat
Fluid.
because both are of negative CT number. قلنا الاثنين CT فدي fat فلذلك appear dark. Lipoma appear dark on. And how the lipoma appear on MRI T1 and T2?
Hyperintense. Both T1
Hyper.
and T2.
Hyper what?
Hyperdense.
Intense or signaling.
Density for the CT. Hyper intense on T1. And how about T2?
Less hyperintense.
Yes, هي برضه hyper intense لكن less hyper intensity. Very good. فإذا فأنت عشان تعرف اللايبوما بس تكون عارف الفات appearance on the CT or X-ray or MRI. لأن اللايبوما is the fat. In CT appear darker. يعني ما عندها negative CT number dark. On MRI T1 بتكون hyper intense. إذا عملنا T2 also hyper intense بس يعني less hyper intensity than in T1. On the plain X-ray بتكون little darker than the other soft than the muscle يعني little darker أكثر سواد شوية منها. إذا لازم تعرف how this. طيب osteomyelitis the clinical presentation.
Previous infection.
swelling.
ممكن يبقى swelling. Yes, very good. Swelling.
Good.
Pain, swelling. ممكن يكون عنده discharge. عنده history of fracture. وأحيانا ممكن يكون عنده history of fracture, especially open fracture. طيب what imaging examination is recommended as an initial technique? The first
X-ray.
X-ray. لابد نعمل
X-ray.
Yes, X-ray should be done first. What are the signs of osteomyelitis on plain X-ray? نشوف ايش on plain X-ray. On plain radiography. طيب نشوف الثري ساينز دي. الثري ساينز دي تحفظوها تمام. soft tissue swelling. بتلقى soft tissue component يعني في المنطقة فيها osteomyelitis soft tissue component. bone destruction ممكن يكون lytic lesion يعني يحصل لنا bone destruction. And periosteal reaction. These are the three signs, early signs of osteomyelitis on plain X-ray: soft tissue swelling, bone destruction, and periosteal reaction. Don't miss the three signs دي احفظهم كويس. طيب هي بتذكرنا بالستريس فراكشر. زي ما قلنا الستريس فراكشر بلين اكس-راي ممكن تكون نورمال، فدي لذلك وبنعمل MRI or radionuclide. نفس الشيء هنا osteomyelitis technetium 99mm radionuclide and bone scan are more sensitive for detection of this osteomyelitis. نفس شنو الكلام اللي قلناه على الستريس فراكشر. طيب what do you see in this X-ray? ايش ده؟ يعني describe what do you see?
Lytic lesion.
Lesions.
lytic lesion. ليش lytic lesion يعني ايش؟
Infarction.
Sclerotic lesion.
لا انا قصدي انه بس describe يعني ايش انت شايف abnormal شنو؟
Capacity.
Calcification.
Yes, there is a calcification. There is a calcification, increase density or opacity in the bone cavity or the bone medulla. But this is a calcification. But this is a زي ما قال patient كان عنده infarction حصل له healing by calcification. Healing by calcification. Bone infarction healed by calcification. But this is a calcification. But what is the cause? What are the causes of the calcification in the bone?
Sickle cell anemia.
Sickle cell anemia. في others زي ما قال radiation therapy. لكن أهم شيء تحفظونها sickle cell anemia. Sickle cell disease can cause bone infection. That bone infection may be healed by calcification. لذلك ممكن نقول لك إنه عندنا X-ray for the lower limbs demonstrate irregular calcification in the medulla. Which of the following may be the cause? ولا بد تكون عارفين شنو sickle cell disease. One of the cause of the calcification in the long bone after healing of the infection. So بيحصل لنا calcification. Yes. You have any question? Yes. Is it clear? All points or all slides are clear for you?
إن شاء الله.
كلير دكتور. يعطيك العافية.
معافيكم إن شاء الله وبالتوفيق. على كل يعني إذا في question يعني don't hesitate to contact me directly through my WhatsApp، لأنه واتساب بيكون أسرع يعني أنا من الإيميل وكذا. بعد ذاك ممكن أشرح لك بالفويس، يعني إذا في أي شيء، أي سؤال، أي نقطة ما واضحة لك أثناء الدراسة تواصل معي. يعني أي واحد يكون عنده رقمي، أنا الرقم بتاعي تواصل معي على طول في أي نقطة ما واضحة. You are welcome anytime إن شاء الله. السلام عليكم.